Instructions to the psychomotor skills candidate for joint immobilization. This skill is designed to evaluate your ability to properly immobilize an uncomplicated shoulder injury. You are required to treat only the specific isolated injury to the shoulder. The scene survey and primary survey have been completed, and a suspected injury to the right shoulder is discovered during the secondary survey. Continued assessment of the patient's airway, breathing, and central circulation is not necessary. You may use any equipment available in this room. You have 5 minutes to complete this skill. Do you have any questions?
No.
Joint immobilization. The candidate takes or verbalizes appropriate body substance isolation precautions.
Scene safety BSI.
The candidate directs application of manual stabilization of the injury.
I direct my partner to manually stabilize the injury.
The candidate assesses distal motor, sensory, and circulatory functions in the injured extremity.
Checking for a pulse. Do I feel a pulse?
The examiner acknowledges motor, sensory, and circulatory functions are present and normal.
Do you feel me touching you?
I do.
Can you squeeze my fingers?
The candidate then selects the proper splinting material. The candidate immobilizes the site of the injury. The candidate immobilizes the bone above the injury site and the bone below the injury site.
Lift your arm for me.
Candidate secures the entire injured extremity. The candidate then reassesses distal motor, sensory, and circulatory functions in the injured extremity.
Checking for a pulse. Feel a pulse. Feel me touching you?
Mm-hmm.
Can you squeeze my fingers?
The examiner acknowledges motor, sensory, and circulatory functions are present and normal.